Welcome to the Parent Prescription, a podcast where I will give you real, practical advice to help you navigate the ups and the downs of raising healthy, happy children without losing your mind. Today's episode is a real and honest conversation that so many families can relate to, but don't always hear talked about openly. We're diving to the journey of parenting and having a child with autism. What it looks like beyond the diagnosis, beyond the labels, and the everyday realities of what autism is. This conversation is not just about autism, it's about adaptation, meeting your children where they are, helping them thrive in a world that doesn't always understand their needs, and making sure we're being inclusive of others that are considered different. So whether you are a parent, a caregiver, or someone who simply wants to better understand, this episode is for you. Let's get into this dose of Dr. C. Okay, it is Autism Awareness Month, and I wanted to dedicate an entire podcast episode on autism so that we can be more in tune with what autism is and what that looks like for the parents and the children and even the people that are around with autism. Okay, and so let's just start with what is autism. Autism is more common, number one, than we think it is. We try to make it seem like a really rare condition, but autism is more common than we think. 1 out of 31 children in the United States are diagnosed with autism. 1 out of every 31. So imagine, out of a classroom, most classrooms now have between 22 and 25 children in a classroom. 1 out of every 31, that's about one kid in every classroom that has autism. And so if that sounds a little more common than you would think, it's because autism spectrum doesn't look the same in every child. You have mild forms and you have the really severe forms of autism. So we need to look at what does that look like. Autism is a neurodevelopmental condition that affects the social communication, social interaction. Sometimes it has repetitive behaviors, but it is a collection of things that is addressed by focusing on communication and social interaction. And it can come with other what we call comorbidities like ADHD, anxiety, learning difficulties, but it doesn't always come with those things. Speech and interaction are the main two things that we look at when it comes to autism. And so when we talk about autism, when we think about the severity of it, the nonverbal children or adults now that have to communicate with movement, motions, nonverbal signals and signs. A lot of times they will have what we call stimming or repetitive motions, circling, running back and forth, flapping motions, abnormal finger movement. And so those are when we think about the severe autistic spectrum, the severity. So when we think about mild, you're just talking about maybe just a communication. Maybe I just don't look at things the same as others. Or maybe a little awkward when you talk about the interaction between friends. Speech, a slight speech delay. And those things can still affect the person, but you may not even recognize that they have autism. And so there's such a wide range of the spectrum that we need to know that it exists, but it may not be as the picture that we imagine. Okay? And so again, it is a neurodevelopmental condition and a collection of things. So how is autism treated? Therapies is the main thing. So occupational therapy, speech therapy, physical therapy if it's needed. ABA therapy, which of course in our area is hard to get into, but ABA therapy, which teaches life skills and the things that sometimes our severe autistic kids need to know that has nothing to do with speech or the interaction with others, but has more to do with the things that they need to know, like buttoning up their pants and dressing themselves, and toilet training that can be a little challenging when you're nonverbal. So these are the things that we need to know so that when we see someone outside of our homes and our children are with us and they're doing stimming motions, or we can explain it to them so that it's not taboo that sometimes children will do those things to get comfortable, or when they're in a stressful or loud environment. You may notice that that will happen. And we want to make sure we're inclusive and we're teaching our children these things, because different is not wrong. And you hear me say this all the time. There are many things that is considered different, but it's not wrong. It's just different. Okay. And so I want to do some fact and myth busters for you for autism so that we can hear what people say or think that may not be actually true. The most common one is autism is caused by vaccines, or vaccines causes autism. Well, that is a myth. There has been so much research done to see if there's a link between autism and vaccines. And as of today, there is no link between autism and vaccines. Autism is not caused by vaccination. Another myth is autism can be cured. And so autism is actually a lifelong chronic condition that can be improved by therapies. So some of the interactions, some of the speech, some of the repetitive behaviors, those things can be improved with time and therapy, but it's not a condition that can be cured and that goes away. All people with autism have special talent or have one thing that they're really good at. Well, just like us, everybody has things that they're good at, but that doesn't mean that there's a math genius. All autistic kids are math geniuses. Yes, there are some that are really good at math, but that doesn't mean that they all are math geniuses, or that they all are really good at art. Or, yes, there are some that have that special ability, but that is not across the board. So that is a myth. Okay. Only boys are autistic. That is a myth. However, boys are 4 times more likely to be diagnosed with autism than girls are. And so the reason why that is the case is because a lot of times the combination or the comorbidities with autism and ADHD come into play when we talk about our boys. And so they are caught a little earlier than the girls. And so they are diagnosed a little sooner and easier than girls are based off of the comorbidities. Autism is usually diagnosed around the age of 4, although by specialists it can be diagnosed as early as the age of 2. And even we can even see some differences earlier than that, sometimes with speech, when kids should be starting to say their first words, starting to babble, starting to play with a parent or with siblings. You can see the withdrawn or the eye contact. You can see some of these things earlier than 2, but a diagnosis usually is not made until 2 years old. Even if we've already started some speech therapy for lack of speech, even if we've already started occupational therapy, a true diagnosis usually occurs after the age of 2, and most commonly at the age of 4. Another myth is that autism is only in mental health, is a mental health disorder. And so it's not a mental disease. It's not a mental disease. We can think of all the mental diseases, but autism is not put on that list because it's a neurodevelopmental. It's more of a developmental condition. And so we don't put it under a list of a mental illness. Although you can have a combination of one with autism. Another thing that I hear is that autism is caused by poor parenting or something that the parents have done. And that is absolutely not true. That is definitely a myth. Autism is across the board it can be in every culture. It's not specific to a certain race. It's not specific to a socioeconomic class. It is not specific to poor parenting or good parenting. Autism does not have a specific range, okay? And so it is not about the parenting. Although the parents can be a little discouraged when they have that diagnosis, because honestly, the resources can be minimal. We have to make sure as we're getting these diagnoses, especially in our area here or anywhere, that we're making sure we're giving as much resources as we can. And so starting the therapies, talking to the schools about the 504 plan or the IEP plan, making sure that we're still learning and getting the as much as we can on learning, extending what we can do, because 70% of autistic kids still graduate with some sort of certificate. Okay. And so we still want to make sure that we're stretching to the limits what we can do in our abilities and making sure we have the resources that are needed. And so some of the concerns that the parents have is that the resources in certain areas, smaller towns, smaller cities, are limited, especially with ABA therapy. It takes a while to get in. The list can be lengthy, and I know we're doing a better job recruiting some of these specialized ABA counselors and therapists, but it still is not enough for what we see here in Texarkana. And so that's one of the concerns and the complaints that the parents have, is not being able to get the services fast enough for their children. One of the last myths that I want to talk about is the stimming behaviors. Sometimes you'll notice that autistic children will cover their ears because things get loud, or it's too much excitement around basketball games, pep rallies, even in the grocery store. Sometimes you'll notice that the parent or someone with them has to hold them or give them, put tightness around them so that they're not stimming or running back and forth or spinning or making loud noises. These things are normal for them, even if it's not normal for us. And so the thought that stimming has to be stopped or is wrong is actually not true. That's their norm. Now, in classroom settings, sometimes it's a little difficult because parents need to understand that teachers have to, for all of the children, have to be able to teach, which is why sometimes we have the smaller classroom settings for autistic kids that are severe, that have to do the stimming. But as far as saying it's wrong or it has to be stopped, that's incorrect also. Okay? And so the reason I did this is because it is Autism Awareness Month, and we want to make sure that we are learning, educating ourselves about differences, about autism, about the fact that it is a spectrum. There's everyone that has autism is not the same, just like we are not all the same, and be inclusive of those things, making sure our children understand that the differences between them and autistic children, and they can still, they still want friends, they still have emotions, they still want to be invited to birthday parties and go to events if it's not in a loud place. These are things that we need to make sure that we are incorporating into our children's knowledge and our own, because autism is not rare. It is something that is more common now that we know how to diagnose it better. And we need to just make sure that we are educating ourselves about that. And so, Autism Awareness Month is the month of April. If you know someone with an autistic child, or if you do have an autistic child, we want to make sure you know that we are making people more aware of autism. Thank you for joining me on this episode of The Parent Prescription. Have a good week.